Paul Tang was with his wife in the hospital just after her knee replacement surgery, a procedure performed on about 700,000 people in the U.S. every year. The surgeon came by, and Tang, who is himself a primary care physician, asked when he expected her to be back at her normal routines, given his experience with patients like her. The surgeon kept giving vague non-answers. "Finally, it hit me," says Tang. He didn't know. Tang would soon learn that most physicians don't know how their patients do in the ordinary measures of life back at home and at work, the measures that most matter to patients. Tang still sees patients as a physician, but he is also Chief Health Transformation Officer for IBM's Watson Health, c. 50 Smartest Companies 2017, that's the business group developing healthcare applications for Watson, the machine learning system that IBM is essentially betting its future on. Watson could deliver information that physicians are not getting now, says Tang. It could tell a doctor, for instance, how long it took for patients similar to Tang's wife to be walking without pain, or climbing stairs. It could even help analyze images and tissue samples and determine the best treatments for any given patient. 50 Smartest Companies, 2017 Browse the list. It's because of possibilities like this that healthcare is one of the hottest segments of the market for machine learning technologies. Research firm CB Insights counts at least 106 startups that have sprung up since 2013 and are still in business. This story is part of our July-August 2017 issue. See the rest of the issue. Subscribe. None of those companies has garnered anywhere near the attention that Watson has, thanks to its victory on the television quiz show Jeopardy! In 2011 and zealous marketing by IBM ever since. But lately, much of the press for Watson has been bad. A heavily promoted collaboration with the MD Anderson Cancer Center in Houston fell apart this year. As IBM's revenue has swooned and its stock price has seesawed, analysts have been questioning when Watson will actually deliver much value. Watson is a joke. Chamath Palihapitiya, an influential tech investor who founded the VC firm Social Capital, said on CNBC in May. However, most of the criticism of Watson, even from MD Anderson, doesn't seem rooted in any particular flaw in the technology. Instead, it's a reaction to IBM's overly optimistic claims of how far along Watson would be by now. In fact, it still seems likely that Watson Health will be a leader in applying AI to healthcare's woes. If Watson has not, as of yet, accomplished a great deal along those lines, one big reason is that it needs certain types of data to be trained. And in many cases such data is in very short supply or difficult to access. That's not a problem unique to Watson. It's a catch-22 facing the entire field of machine learning for healthcare. The problem of missing and inaccessible data may slow Watson down. It may hurt IBM's competitors more. That's because the best bet for getting the data lies in close partnerships with large healthcare organizations that tend to be technologically conservative. And one thing IBM still does very well in comparison to startups, or even giant rivals like Apple and Google, is gain the trust of executives and IT managers at big organizations. The specific problems with the MD Anderson project notwithstanding, IBM has a crucial advantage. It's getting Watson inside a wide range of medical centers, healthcare administration groups, and life science companies, all of which are positioned to provide the critical data needed to shape AI's future in medicine. Unrealistic timelines. The breakup with MD Anderson seemed to show IBM choking on its own hype about Watson. The Cancer Center and IBM partnered in 2012. The goal was for Watson to read data about any patient's symptoms, gene sequence, and pathology reports, combine it with physicians' notes on the patient and relevant journal articles, and then help doctors come up with diagnoses and treatments. But IBM and MD Anderson both overinflated expectations for the technology. IBM claimed in 2013 that a new era of computing has emerged, and gave Forbes the impression that Watson now tackles clinical trials, and would be in use with patients in just a matter of months. In 2015, The Washington Post quoted an IBM Watson manager describing how Watson was busy establishing a collective intelligence model between machine and man. The Post said that the computer system was training alongside doctors to do what they can't. Healthcare has been an embarrassingly late adopter of technology, says Manish Kohli, a physician and healthcare informatics expert with the Cleveland Clinic. In February of this year, the University of Texas, which runs MD Anderson, announced it had shuttered the project, leaving the medical center out $39 million in payments to IBM, for a project originally contracted at $2.4 million. After 4 years it had not produced a tool for use with patients that was ready to go beyond pilot tests. MD. Anderson wouldn't comment to me about Watson specifically, but it appears that the problems stemmed mainly from internal struggles over how the project was managed and funded. That's not to say IBM has no troubles with Watson. Indeed, they're larger than what any one implementation reveals. To understand what's slowing the progress, you have to understand how machine learning systems like Watson are trained. Watson learns by continually rejiggering its internal processing routines in order to produce the highest possible percentage of correct answers on some set of problems, such as which radiological images reveal cancer.